Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Fewer than half of drug overdose survivors go to the hospital. Break. Among survivors of drug overdose, fewer than half visited the emergency department, according to a study published online October 16 in JAMA Network Open. Break. Brendan Salona, Ph.D., from Brown University in Providence, Rhode Island, and colleagues examined service use following a non-fatal overdose, NFOD. The analysis included a telephone survey of 2,097 adults who used cocaine, opioids, or methamphetamines in the previous 12 months. Break. The researchers found that 25.7% of participants had experienced at least one FOD in the prior year. During the most recent FOD, use of naloxone was reported by 82.1% of survivors, while calls to 911 were reported by 61.3% and visits to the emergency department were reported by 47.0%. A call to 911 was more likely at the most recent overdose event for non-Hispanic Black people versus non-Hispanic white people, adjusted odds ratio, AOR, and number 137:1.79, P and number 137 equals and number 137:0.02, and by people who used drugs a few times a month at the time of the interview, versus no drug use, AOR, 3.83, P and number 137 equals and number 137:0.02. The most common reasons cited for not calling 911 were that the person regained consciousness without naloxone, 28.6%, or that a bystander administered naloxone, 26.8%. Of those going to the emergency department, most, 61.5%, received take-home naloxone in the hospital, while fewer reported receiving buprenorphine, 21.9%, or methadone, 16.2%, before discharge. Break and number 156, connection to medical care serves as a vital opportunity to understand what an individual's goals are, and if interested, offer options to seek specialty addiction care and treatment, including medical management, or harm reduction tools, such as naloxone, fentanyl test strips, etc., and connection to community resources to support recovery and well-being. And number 157, Sandeep Kapoor, MD, from Northwell Health, who was not involved in the study, said in a statement. Break abstract/full text. Break disclaimer, statistical data in medical articles provide general trends and do not pertain to individuals. Individual factors can vary greatly. Always seek persona less than /speak. Specialized medical advice for individual healthcare decisions. Break and copy, 2025 Health Day. All rights reserved. Break ad as a preferred source on Google. Read this next: many young adults use cannabis or alcohol to get to sleep. Break, more than 1 in 5 young adults report using cannabis or alcohol to get to sleep, according to a research letter published online October 13 in JAMA. Break ASA, deaths from fentanyl plus stimulants rising in older adults. Break, overdose deaths in older adults from fentanyl mixed with stimulants, such as cocaine and methamphetamine, have surged in the past 8 years, according. Break tramadol may have slight effect on reducing chronic pain. Break, tramadol may slightly reduce chronic pain but seems to increase the risk for serious and non-serious adverse events, according to a review published. Break more news resources for MedWatch Drug Alerts Daily Med News for health professionals, new drug approvals, new drug applications, drug shortages, clinical trial results, generic drug approvals. Subscribe to our newsletter. Break whatever your topic of interest, subscribe to our newsletters to get the best of drugs.com in your inbox, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.